Thank you for joining us. My name is April Ballhazer, and I'm the Program Director here at Silver Oaks Behavioral Hospital, and I'm joined today with Veronica Hughes, our Chief Nursing Officer. We're going to talk today a little bit about how to stay healthy, both physically and mentally during these challenging times.
Thank you for having me, April. Some things that you have to consider, is it safe to go back to the hospital? And absolutely. We definitely want to make sure that we're taking care of ourselves both physically and mentally. And some things that you're going to see when you go to a hospital, some things have changed. And one of that is the screening process. You will be asked once you walk into a hospital a series of questions. And then also taking temperatures.
Sure.
Here at Silver Oaks, we take a thermal scan to make sure that we're not running a fever or exhibiting any signs or symptoms of COVID-19. So you'll also receive a mask. Sometimes they look like this a general PPE surgical mask. Or if you come in with your own masks, here we have the Cubs and the Bears mask because we're in the state of Illinois. But you want to be masked to make sure and cover any droplets of your own, plus you're not intaking any droplets. So those are some definite measures that we're taking in order to make sure that it's safe in the hospital. We're also making sure to encourage social distancing. Maintain that 6 foot of distance between each other when you're in the hospital. Practice good hand hygiene. There's many stations throughout the hospital for hand hygiene and make sure that, you're utilizing the alcohol hand sanitizer. There's other things that you can do at home. Some of those things at home when you're going from your workplace into your environment have to do with ensuring that you have a set of clothes available. Some of those folks that weren't going out into the workplace now in that phase 3 of opening the state of Illinois, you will be. And so there's some preparation that needs to be taken, such as make sure you have that set of clothes, make sure that you're washing your hands before going into your environment and staying on the couch and exposing yourself to your family. How do you transition from that phase, of a social isolation where you were actually at home? How do you transition with that, and what were you doing at home at the time?
Sure. Isolation at home has looked a little bit different for everybody. Some of us have been living with our family or maybe roommates, our children, and some of us have been isolating and all alone because we live alone. Mm-hmm. So it's really important that for those of us that are continuing to stay home and try and distance as much as possible, from the public to ensure that you are maintaining healthy boundaries at home. You're taking breaks. You have personal time when you need it. If there's children in the home, kind of switch off those responsibilities. Now that it's finally getting nice in Illinois, get outside, get some physical activity. Just ensure that you're trying to do everything as normal as possible, despite everything that's happening. One really important part is if you are living alone, so you have been isolating completely on your own, to make sure that you are reaching out, that you're using social media platforms, Zoom calls, FaceTime calls, anything that you can to connect with others. Mm-hmm. While our World Health Organization, the CDC, has all recommended this self-isolation in order to stay as physically healthy as possible, it's really just the opposite of what we want to do in order to stay mentally healthy. So it's really important that we reach out to each other and have a way to connect.
Right. And definitely now that we are starting to venture out into the new norm and getting exposed and going back to work, that can bring some increased anxiety.
Sure.
What are some things that I should be aware of when I should get help? When is it more emergent that I get help? What are those things?
Sure. The symptoms that people might have been experiencing or maybe moving forward, they can look different for everyone. A lot of anxiety, like you said, uncertainty for the future. We don't know when we may return to normal. Or what that will look like. It could be irritability for some. It could be just a general overall sadness. Mm-hmm. It looks a little bit different for everybody. But it is really important to continue to reach out and to get that help when you need it. We don't want to delay medical or behavioral health care right now, despite everything that's happening.
Mm-hmm. And so let's say, I'm okay, I think I could do the Zoom call and everything, but what if I start having thoughts of harming myself, harming others? What should I do then?
Sure. Certainly if your symptomology or the things that you are feeling do feel bad enough that you are having those thoughts of harming yourself, harming someone else, please, of course, we want to encourage everyone to reach out, call 911 immediately. You can contact Silver Oaks Behavioral Hospital 24 hours a day and speak with a mental health clinician in order to get an assessment, either a tele-assessment. You can come in person. We just want to make sure that everyone is as safe as possible and taking care of their mental health, especially in these challenging times.
Awesome. Thank you so much, April. Thank you for having me.
Thank you.